Hi everybody, my name is Tandi and welcome back to my YouTube channel. So today we will be talking about health facts that people keep getting wrong. There's a lot of myths that are often spreading and I want to bust some myths today, and particularly around HIV. Yes, I know HIV is an old virus that has been in existence for a lot of time, for a couple of decades. And yes, some of you might feel like, we know a lot about this, but I have observed a lot of misinformation spreading on social media, especially in South Africa. And the thing about HIV is that it's still highly prevalent, right? There's a lot of people that are living with it, especially among young women. So as much as I know it's not new, I realize that the landscape has changed, but the public understanding has not kept up with this change. So HIV care has evolved, right? A lot, and the science behind it has evolved, but community narratives have not. They've not kept up with this evolution. So what do we know currently? We know that ARVs, which is the treatment for HIV, ARVs are highly effective as treatment. We know that the concept of U equals U, meaning undetectable equals untransmittable, it's still a bit poorly understood as a concept. We know that HIV is a chronic condition, but it is not a death sentence, right? But many people are still operating with that fear-based information that we used to get, particularly in the 2000s. If you've lived in the 90s and the 2000s, you know that there was a lot of information around this, and a lot of it was fear-based, and I could understand why they were trying to instill fear in us. It was a protective way, I guess, of going about it when it comes to health education, to just try to get people to be afraid of this, and hopefully so that a lot of people will not contract the disease. And especially at the time, we didn't have proper treatment yet, and even like preventative methods, right? We have PrEP now, but back then there was a lot that you had to warn people about because we didn't have proper treatment to actually ensure that people don't end up dying from AIDS, which is the disease that comes up after you've contracted HIV. You do not get treatment. So for me, this entire gap, I've realized that it creates confusion, it creates stigma and poor decision making, particularly around shaping people's health behavior. So in today's video, I'm going to be busting some myths around HIV that are still spreading in South Africa and are still harming people. Let's get into it. Myth number one, there's this one where people say you can tell if someone has HIV by just looking at them. Like, what? That is ridiculous. It's completely ridiculous, and purely because you can be HIV positive and not have any symptoms for years, right? So the most effective way to know if someone is HIV positive, honestly, seriously, easily, it's just to get tested. There's a long period of asymptomatic infection, hence it is recommended that everyone gets tested as part of their routine blood work. You know, you get tested regularly and as much as you can, just to make sure that you're fine there, especially if you know you are engaging in behavior that puts you at risk for this particular virus. Myth number two, HIV is a homosexual disease. The fact is, men who have sex with men are often described as a high-risk population. And the reason for this is because HIV is transmitted much more easily through anal sex. And that is because the anus, or the lining of the anus, it's thinner. So it is much more prone to small tears. It's prone to small cuts and small openings, which makes it easier for HIV to enter the body. However, when we look globally, actually, you'll find that in regions like sub-Saharan Africa, where we are, HIV transmission through heterosexual sex, it actually makes up most of the new infections. And you do need to keep in mind that even though this is the case, it's not necessarily because heterosexual sex is much more dangerous. It's generally because there are more heterosexual relationships than there are homosexual relationships. I think that's actually just a good point to just remind you that you really do need to keep in mind that context matters when you talk about health and when you talk about risk, because in this case it's more prevalent, sure, in one population over the other. It doesn't necessarily mean that this population is at higher risk. It's just there's more of it than there is of this particular population, right? So the key point is HIV is not about sexual orientation. It's about exposure and biology. And anyone who has unprotected anal or vaginal sex with somebody who's HIV positive, they can be at risk, regardless of whether they are heterosexual or homosexual. Myth number 3 is that I can get HIV by being around people who are HIV positive. Fact is, HIV isn't spread through touch, tears, sweat, saliva, or pee, right? So you can't catch it by breathing the same air as somebody who's HIV positive. You will not catch it by touching a toilet seat or hugging or shaking hands with somebody who's HIV positive, or sharing and eating utensils, right? Using the same exercising equipment at the gym, for instance. You can get it from infected blood, infected semen, infected vaginal fluid, or breast milk. All the other nyaga, out with it. Don't stress yourself with it. It's not going to be a problem for you. Myth number 4 is that traditional medicine can cure HIV. This one is a bit tricky, I understand. I'm an African, and I know we do use herbal medicine for certain things, and I'm not against that at all, right? But the fact is, there isn't evidence, or empirical evidence rather, that shows that traditional medicine or herbal medicine can treat or cure HIV. And in fact, in some cases, it's found that actually some herbal medication or even traditional medicine can interact with ARVs, which can cause therapeutic failure. So essentially the drugs will not work as intended. It can lead to toxicity and perhaps even non-adherence to your medication, because you're going to be thinking, oh, I'm taking this herbal medication, I don't need to be on my ARVs or take them as regularly. So it is something that is still not been shown to be effective or to work. So it's definitely a myth. I don't know, unless you guys have seen alternative information out there, please share it. But for me, so far, with everything we do in healthcare, it has to be, unfortunately and also fortunately, it has to be backed up by data. It's that simple. Myth number 5, mosquitoes spread HIV. Well, no, I can understand why people generally think the virus can be passed through blood. Fact is, because the virus is passed through blood, people have worried that they can get it from biting or blood-sucking insects or bugs, right? But this is not the case. Even in the areas where there are lots of mosquitoes and there are high cases of HIV. And this is because when bugs bite, guys, we know this, when bugs bite, they do not inject the blood of the person or the animal they bit before you, right? And also another important thing, HIV does not live that long in insects. So that is something to consider. It is a virus that prefers CD4 cells, which primarily are found in human beings. I don't know actually if they could be found in other animals, but they are predominantly found in us as people. So it is something you don't have to worry about. Honestly, it is a concern that you hear about, but it's actually shouldn't be a concern. Myth number 6, I am receiving treatment and therefore I cannot spread HIV. This is a bit of a tricky one and it has some nuances to it. So let's try and break it down a little bit so that it kind of makes sense. So when somebody's living with HIV and they're taking their antiretroviral therapy or their ARVs and they're taking them as required, as prescribed, and they have a durably undetectable viral load, they cannot sexually transmit HIV to their partners. And this is a well-established finding. It has been shown in or supported by large clinical studies and also endorsed by major authorities. And essentially, it's that messaging that they call U equals U. Undetectable means untransmittable, right? So as much as U equals U is one of the biggest advances in HIV science, you need to remember that it will depend on having access to the treatment itself. It will depend on adhering to the treatment itself. It will depend on also you being monitored as well. Because remember, you have to be undetectable. And I think the threshold, the last time I checked, it was supposed to be less than 50 copies per milliliter of HIV in your blood, that then you would be deemed as undetectable. So it is also still important to remember that, like, for your sexual health overall, you need to think about other STIs, obviously, and pregnancy prevention if you're not ready for that. But in terms of HIV transmission through sex, effective treatment eliminates that risk. The key takeaway from this messaging or from this video is that HIV hasn't stayed the same, right? But the stories that we tell about it, they often have remained the same. So when we hold on to these outdated myths, we feel stigma. We feel fear instead of health and dignity. So you need to make sure that you are staying on top of things. This is just not for your health only, but also just having accurate information as a tool or as a weapon for you to just live a better life. So if you found the information I shared on this video helpful, please like, share, and engage with it, and so that it can reach more people. And as always, please do let me know what kind of health topics you would like me to tackle. If there are any pressing health topics you'd like me to cover next, and I shall do so. Until next time, bye-bye.